a minute or so. I'll let everybody kind of get on. My name's Kaci. I'm a registered nurse. I work in labor and delivery. So typically this class that I do, I actually have a slideshow for it. And so what I can't present that to you on Instagram, so I'll kind of frequently be looking off to my left to kind of refer to those slides, so you'll have to bear with me. I just want to make sure that I can go over everything with you guys in the next 45 minutes to an hour or so. Is everybody pregnant? First-time moms? Have a newborn? Okay, it's 5 o'clock, so we'll get started. Again, my name's Kaci. I am a registered nurse. I work in labor and delivery. I've been a nurse for about 12 years now, and I've been in women's health almost the entire time. I am the mama coach in San Angelo, Texas, and I started this adventure because whenever I became a mom for the first time, I just knew I was going to do great. I was teaching women how to breastfeed, and I got home with my baby, and I was so lost, and I thought, oh my goodness, if I feel this way as a labor and delivery nurse who teaches women how to do this, then I can't imagine how women feel that don't have this education once they get home from the hospital. Because once you get home from the hospital, that support system, it goes away as far as like nurses and doctors and lactation specialists. And so that's how I kind of came about doing the mom coach stuff. So we're going to get started. We're going to start off with just simple breast anatomy. So I'm going to get my crocheted boob out. And so we are going to talk about breastfeeding today, and I'm just going to give you just the basic tips to kind of make you feel a little bit more comfortable when your baby's born, and you'll have a little bit of a leg up once it's time to breastfeed him or her right after delivery or within the first hour or two after delivery. So you have your breast, you have your areola, the nipple, and then right here is your breast tissue, okay? Everybody has milk ducts in their breast. Everybody has 4 to 18, and you just don't know how many are there. Everybody's different, but they are all around your breast, okay? So we are going to be talking about breastfeeding, and a lot of times women just think about the nipple during breastfeeding. But the thing about breastfeeding is it actually involves both the nipple and the breast tissue, okay? It takes both of these things to get the milk production flowing. So you have to stimulate the nipple, but you also have to stimulate the breast tissue. So we have to remember that whenever we start getting the baby latched on. The very first thing that you are going to make, and if you're 20 weeks along already, your body is already making this. It's called colostrum. You will hear it referred to as liquid gold, okay? This is your baby's very, very first food. If you're 20 weeks, you may have leaky breasts at this point, and you may not. And if you aren't leaking, that is okay. I don't want you to worry about that. It doesn't have any, it doesn't indicate anything about your future production if you're not leaking milk or colostrum at this point in time. But if you're 20 weeks, you are making it, okay? So it's your baby's first food. It's very, very low volume, but it's very high calorie. It's very concentrated, and it's exactly what your baby needs whenever your baby's born. So your baby's tummy is tiny, 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 like this big whenever he or she's born. And so if you think about colostrum, it's very thick, it's syrupy, it's yellow, and it's filling. It doesn't take a lot to fill up their tiny little tummies. And so during that time, whenever you're feeding your baby the colostrum, you're going to feel like you're not feeding them a whole lot, but you are. It's doing everything that you need them to do. So that is the very first thing that you make, is the colostrum. Once your milk comes in, 3 to 5 days later, you have something called Foremilk and HindMilk, okay? The Foremilk is very liquidy. It's almost like water. You can, if you were to pump, you would see it separate, and you would see like, not see-through, but cloudy white, and then on the bottom you would have thick, creamy looking milk. Okay, so that's Foremilk and HindMilk. They both serve a very important purpose in feeding your baby. And so I want you to think about if you are going to turn on the sink and turn on running hot water. Well, when you first turn on the hot water, it's cold, and that is going to be kind of like your Foremilk. So you latch your baby on, and they start sucking and they start drinking, and they're getting the Foremilk, and that's essentially the hydration, okay? Eventually, the longer your baby's at the breast, it kind of slowly turns into HindMilk, which is fatty, high calorie, high protein, and that's the bulk of their meal is the HindMilk. And so the two together is what makes your breastfeeding experience good, and your baby needs both of those to have an effective feed. And so we really recommend that you start off on one breast and empty it all the way. And I say empty loosely because your breasts are never empty. They are always making more. But your baby will tell you whenever it's starting to empty. Okay, they get sleepy at the breast. They slow down. So they'll suck, swallow, suck, swallow, and they will drink and drink. Some babies drink for 10 minutes, some drink for 20. Everybody's baby is very, very different. But when you think your baby is finished nursing off of one breast, what I want you to do, and I will talk about this more here in soon, is hand express, and you're just going to pull back and pull forward, and it's going to shoot some milk into their mouth, and it's either going to stimulate them to keep drinking off of that breast, or they're going to still get sleepy and be finished. Do that a couple of times before you switch breasts. If they're still not interested after you have done that, I want you to take your baby off. This is Hope, by the way, and she's kind of scary looking. It's my daughter's doll, but anyways, take your baby off. So you'll take your finger and unlatch her, and then I want you to burp her, okay? Now, in the beginning, whenever you're feeding her colostrum, again, it's thick. You're not going to get a lot of burps there because it's not like they're swallowing a lot of air. They're just swallowing that thick colostrum. Later, once your milk comes in, you will probably get some burping going on. Anyway, so I want you to feed off of one breast all the way till she's finished, and then I want you to burp your baby. And after you're done burping her, I want you to go ahead and offer the other breast, okay? We think of this as dinner and then dessert. She probably will not eat all the dessert. She's full off of this breast, but you're going to offer this breast because she may still want a little bit more, and that's okay. And if she doesn't, then that's okay too, but you're stimulating your breast to make more milk, okay? It's supply and demand. So the more stimulation that you can do on your breast, the more milk that you will bring in. The next feed, you're going to start on your dessert breast. Okay, so you're going to start on the breast last used. Okay, so that's very important. Babies, not all babies, and everybody's different. You're going to find all kinds of different information, and you're going to figure out what works for you. But it's important to not time your feeds, just to feed on demand, let them empty, burp, and then give dessert and start here on the next feed, because it helps decrease gassy babies. It helps them to get an equal amount of Foremilk and HindMilk instead of just Foremilk or just HindMilk. So it also helps you to use both breasts and stimulate both breasts and get both your breasts making milk. So I want to talk about antenatal expression. This is something that you can do when you're pregnant to help bring in your milk and set you up for success. It gets you comfortable with touching your breasts, because I think one of the biggest mistakes that I even made was I did not realize whenever I brought my baby home or when I started breastfeeding that I was going to have to be manipulating and handling my breast so much? Well, if you think about a baby who's bottle feeding, you have to hold the bottle for them. They can't hold the bottle. And so the same goes for your breasts. You really have to get comfortable holding your breasts, touching them, and manipulating them. So this is where antenatal hand expression is awesome, because it gets you comfortable doing that. It also sets you up for an ample milk supply for months afterwards, because it starts stimulating your breasts to start making that milk even before your baby comes. The other thing that's awesome about antenatal hand expression, which again is making milk and saving it during your pregnancy, is that you end up getting a little bit of a stash before your baby's born, which is so awesome, because if you go to the hospital, and we all know that right now you don't have a big support system because of COVID, you can only have one person, and so it's nice because then you can bring your stash to the hospital with you if you need it. You may not even need it. Your baby doesn't typically need to be topped off or supplemented in the hospital, but there are rare occasions, like for example, if you're gestational diabetic, if you have a really big baby, if your baby comes out and is jaundice or is really, really small, sometimes those babies need a little bit of supplementation after they're born. And there's absolutely nothing wrong with giving formula for that. But if you've been doing antenatal expression and you've been saving your milk, then you have your very own stash of your very own breast milk to give your baby. And you just have to make sure you take it to the hospital with you. Or if they need to be supplemented and you don't have it, then of course formula. There's absolutely nothing wrong with using formula. So those are some instances when you could use a stash before you have your baby. So let's talk about how you're going to do this. First of all, you don't start doing antenatal expression without the permission of your doctor. You have to ask your doctor. There are a few instances when you cannot do it. For example, if you have a placenta previa or a low-lying placenta, or even like preterm labor, then your doctor may not want you to participate in an antenatal expression class or course. So ask your doctor. If you get the go-ahead from your doctor, then you would start at full term, which is 37 weeks. So you can do it twice a day from 37 weeks up until you have your baby. So you do it in the morning and then you do it at night, and you do it for 5 or 10 minutes off of each breast. And in the beginning, you're not going to get a whole lot of volume, and that's okay. You're not used to doing this. Your breasts aren't used to producing that volume. But the more you do it, because it's supply and demand, your breasts are going to start making more, okay? And eventually, you're going to have enough to actually save in a syringe with a cap and put in your freezer. So, how do you do it? And this is stuff you can practice at home before you have your baby. So get comfortable touching your breast, because if you're gonna have to do it. So what you're gonna do is you're gonna take your breast and hold a C hold, okay? Back away from your nipple. It's not this number. And even when you're breastfeeding your baby, you cannot have your fingers or your hands up here, because it's not nipple feeding, it's breastfeeding. So you have to actually back your hand up. Your baby needs to get as much as this in their mouth as possible. So if your hands are in the way, then that's not going to be a good latch, and you're going to have a lot of trauma and sore to your nipple. Anyway, so back to antenatal expression. So you're going to back up, make a C hold, and you're going to pull back to your chest wall and then squeeze forward, okay? Pull back to your chest wall and then squeeze forward. Initially, you're just going to see a little glisten, and that's great. Eventually, you're going to have actual drops come out. When you have drops come out, you're going to need a medicine cup, and all you have to do is drip it in like this, okay? So pull back to your chest wall, squeeze forward. And remember, there are milk ducts all the way around your breasts. So you want to make sure that you are doing this all the way around your breast. And so you'll do that for 5 or 10 minutes, and you'll drip it in here, drip it in here, drip it in here. And eventually you're going to get a tiny little bit, like this much. But remember, your baby's belly is tiny, and this is great. Your baby hasn't even been born yet. And even when they are, this amount is perfect. Their little bellies are tiny. So you're going to pull it up in here, put your cap on, and then label it, date and time it, and stick it in the freezer, okay? You're gonna use the oldest milk that you've expressed first, and then so on and so forth. So you can do that twice a day. I didn't mention this, but whenever you do start doing antenatal hand expression, make sure that your hands are clean. Wash your hands. Make sure that your equipment is clean. These are oral syringes. This is a 1cc syringe with a cap. You can get these from pharmacies. I make these kits and mail them out if you order the antenatal hand expression course. And so there's always that option to do as well if you're interested. And that one comes with an actual online course that walks you through and gives you an ebook and all the information on how to do that as well. So that was antenatal hand expression. So let's talk about nipple sandwiches. So your baby's latched on, okay? This is my favorite tip. If I could tell you my one tip to give you is that when you're feeding your baby, I want you to hold a nipple sandwich. Nipple sandwich looks like this. And remember to take your hands away from your areola, make a C, and squish it flat. The goal is to get your nipple in the roof of your baby's mouth, okay? So this is a nipple sandwich. So you're going to hold this nipple sandwich the whole time that you're feeding your baby. Because again, if you think of your breast like a bottle, they can't hold their own bottle. And so this is essentially their bottle, and you need to hold it for them in the very beginning. Eventually, a few months down the road, they're not going to need that from you anymore. But in the beginning, they do need help. And so once your baby latches on, I don't want you to let go of this, okay? I want you to hold on to it for the entire time that they're nursing. It helps keep the nipple in the roof of their mouth, which stimulates their sucking, but it also helps you have a really good latch. So nipple sandwiches are a must. You have to do nipple sandwiches and hold on to them the whole time. So feeding and skin to skin. So your baby is born. Let's talk about skin to skin and why it's important. So skin to skin, we call this the golden hour after delivery. And I do have to say, it's unfortunate that COVID has taken away guests from being in the room other than your support person. However, I am seeing more and more moms get to enjoy the golden hour without having to worry about who's going to hold their baby and pass their baby around. So there is a silver lining to this, and it's awesome that you get to stick your baby skin to skin in your shirt. And if you are recovering from a C-section or something, your husband or partner or mom or grandma, whoever's with you, they can do skin to skin. So it doesn't just have to be the mom. So skin to skin, it's important because number one, it keeps your baby close to you, and you can start learning what your baby's feeding cues are going to look like. Okay, and second, they don't regulate their temperature very well. And so they are on your chest, you get a warm blanket, you put it over them, and you get to keep your baby warm. Eventually, after your baby is born and they've been on your chest, what you're going to be looking for are feeding cues. And what that looks like is what we call like rooting around. They'll start kind of bobbing their head. They'll start kind of sucking on their hands, and those are early feeding cues. So that is the perfect time to start trying to latch your baby on. Another thing that they will do is a lot of times you'll think your baby's yawning, and it's actually not a yawn. It's called rooting, and they'll go like this. and they'll probably turn their head towards your breast. They are looking for the nipple. They are hungry. And so skin to skin is great because you don't miss that opportunity and you don't miss those feeding cues, and you get your baby latched on almost immediate. And the sooner you can latch your baby on, the sooner your body is told to start making in milk. So how do you latch your baby on? So we talked about the nipple sandwich. Another great thing to talk about is an asymmetrical latch. Okay, a lot of mothers, they will want to, and I did the same thing. I think it's a learning curve. You're learning your baby and you're learning yourself. And you've never breastfed before. So naturally you're gonna want to put what we call the bullseye, which is mouth to nipple. And that makes breastfeeding a little bit more difficult because what's going to happen is they're going to open their mouth really, really big. And remember, your goal is to get your nipple in the roof of their mouth. Well, if you're mouth to nipple and they open their mouth really big, they're going to latch on way up here. And the nipple is not going to be in the roof of their mouth. So whenever you're getting ready to latch your baby on and you're holding your nipple sandwich, I want you to remember to do nipple to nose, okay? Nipple to nose. So your baby's nose to nipple. That way, whenever they do open their mouth really big, they're going to latch on. And you can see how the tip of the nipple is pointing up to the roof of their mouth. That is going to get the nipple right where it needs to be. And when it's in the roof of their mouth, it's going to stimulate them to suck. So nose to nipple, okay? Nose to nipple. That also gets the bulk of the breast tissue underneath your breast in their mouth versus on top. And so that just gets a really good latch. And latch is key in breastfeeding because if you do not have a good latch, you're going to get really sore nipples, cracked nipples, and that is not good. So feeding positions. My favorite position to start with whenever you're learning to breastfeed is the football hold. And I like this one because it gives you a lot of control. And what you do, and this one's also really, really good if you have large breasts, is the football hold. But it's very good for beginners also. So what you're going to do is you're going to tuck, and we usually say tummy to tummy, but it'll be more side to baby's tummy. You're going to tuck her in here, and you'll have pillows underneath. You'll take her little arm, and you're going to hold right here behind her neck. You sometimes are going to want to do this, and that's not going to work because if you think about somebody putting their hand on the back of your head, naturally you kind of want to buck them off. So move your hand down behind her neck and support her shoulders, okay? Tuck her in real good. Get situated and see how much control you have. Another thing which I just showed you is when you're learning, you're going to want to drop your nipple in their mouth. And I want you to really be cognizant of that and try and bring baby to you. Okay, bring baby to you. You get a better latch that way, but it's also easier on your back and your posture as well. So this is what you call the football hold. So here you go. This is football. This next one is called cross cradle. This was my personal favorite, and you'll find what works for you. It's all about trial and error. Get these cords out of my way here. This next one is called cross cradle. So cross cradle looks like this. You're going to take your hands, put it behind your baby's neck, not their head, and then you're going to have control over your breast on the outside here. So, and that's what this looks like. This is cross cradle. Another one that you'll do, and you'll see this one, you see this one a lot, I feel like, is just regular cradle. And this one is where you have your baby in the nook of your arm, and you actually use your outer arm towards, so you reach in towards your breast this way, and you use like this, okay? And notice how I'm bringing the baby to me. It's a learning thing. If you have a baby doll or a stuffed animal at home, you can practice that now because it is a little awkward and it's a learning curve as well. So that is something you can practice before you have your baby as well. And that'll help you the day that you deliver. So let's talk about what an effective feed looks like, sights and sounds. You're going to be watching for big sucks and swallows. In the beginning with a newborn baby, remember that colostrum is very, very thick and syrupy, and so you don't hear a lot of gulping, not to mention your baby's tiny. And so you're not going to actually hear a whole lot of things whenever they're drinking colostrum. When your milk comes in 3 to 5 days later, you will start hearing them swallow, and it'll sound just like we swallow, that kind of gulping noise. But in the beginning, in the first few days of life, you won't hear a whole lot of that. What you'll see is big jaw movements, and what they'll do is they will suck, 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 pause, and they'll swallow in that pause. Suck, 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 pause, and that's a swallow. If you're really, really quiet, you can hear kind of a little k, k, like a K noise. And that is them swallowing. If you notice that they are suck, 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 swallow, and getting sleepy, remember to do your breast compression. Wake them up, give them a surge of that milk, and remind them that they're eating. These babies get warm and snuggly and all cozied into you, and then they want to fall asleep and forget that they're feeding. So remember to do breast compression if they start getting snoozy. I was going to say something else. I lost my train of thought. Oop. So, engorgement. This is when your milk comes in. Again, 3 to 5 days later. Everybody's different. And I do want to let you know that if you have a C-section or if you bleed a lot after delivery, your milk may take the latter end to come in. So 5, maybe even 6 days to come in. So don't worry. It will come in. And trust me when I say you will know. Your breasts are going to get full. They are going to get up to your collarbones. You're going to have breast tissue in your armpits. It's going to feel like your forehead. Yes. Jazz. Is it true breastfeeding can be almost every hour? Yes. Yes, it's called cluster feeding. So babies are born and they know what they're supposed to do. They may need to practice, but they have this innate ability and need to want to suck, and they know that they're supposed to bring that milk in. And so you'll notice that your baby is starting to want to feed all the time. And I don't want you to worry thinking, oh my goodness, I'm not making enough milk. My baby's starving. What your baby is doing is telling your body to make more milk to bring your milk in. It's called cluster feeding. So it's very, very normal. And I really, really, really recommend putting your baby to the breast every single time that they want to suck on something in the newborn phase, like in the first week or two. Let them passy on you if you can stand it. If your nipples are not sore, if they're not, blistered, let them suck on you as much as you can tolerate it, because it's just going to bring your milk in. It's supply and demand. And so they are going to stimulate those nipples and that breast tissue to bring your milk in quicker and more abundantly. Once your milk is established, then you can start using a soother, and we'll talk about that in just a second. Also, my opinion on soothers and nipple confusion. But engorgement, I want to talk about that. So that is when your milk really slams in. Okay, you're going to be really full. It can be very uncomfortable. Your breasts get very sore and rock hard. The answer to fixing that is going to be feed. Feed your baby. If you need to, you may notice that your nipples are now flat because your breasts are so full, and there's not going to be anything for your baby to latch onto. So you may have to actually hand express just a little bit off, enough that you can get your nipple to where it can actually be nipple sandwiched and into your baby's mouth. Your baby has to have something to latch onto. You can do warm compresses before the feed or before you pump. And then after you feed and nurse, you can do cold compresses. You can also do Motrin and Tylenol if you're not allergic, and that kind of helps take the edge off of being uncomfortable. Once your milk regulates after a week or two, you won't feel that engorgement as much anymore. Your baby is going to start regulating and telling your body how much milk to make. So, sore nipples. Okay, so your breasts are not used to being nursed on. They've never been used in this way ever before. And so you are going to be kind of a little bit sore. You're going to be bruised feeling, especially, by the way, I didn't mention this, but if you do antenatal hand expression, in the beginning, you are going to feel bruised because, again, you're not used to handling your breasts that way. Same goes for breastfeeding. Your breasts are going to be sore. Your nipples are going to be a little bit sore. They're not used to being sucked on in that manner. However, with that being said, you should not have cracked nipples. They should not be bleeding. They should not have blisters on them. If you have any of these things, do not push through. I want you to let your nipples rest and pump. If you need to pump for 24, 48 hours and let your nipples heal, it is okay, and it is not going to deter your baby from breastfeeding. You'll have to either give a bottle during that time, you can syringe feed your baby, you can spoon feed them, whatever you need to do. But if you continue to nurse with sore, cracked, bleeding nipples, it's going to cause a lot of pain and trauma to your nipples, and you're not going to want to continue anyways. So, I also want to say that initially, whenever you're breastfeeding, your baby's going to latch on, and it's going to be a little bit uncomfortable at first. And by at first, I mean for the first 30 to 60 seconds, because your nipple is being sucked on and they suck hard. And so it's a little bit shocking and uncomfortable, and you're not used to feeling that way. However, it should not hurt the entire feed. It gets better after about 30 to 60 seconds. If it does not go away and you feel like you have razor blades on your nipples, if you feel like you have a hot fire poker poking in your side, you need to take your baby off immediately and relatch. Okay. Nipple ointment. You can use nipple ointment. Another great thing for sore nipples is your colostrum. You can hand express and rub it around your nipples and let it air dry. And I didn't mention this, but if you do have to take a break and let your nipples rest, then you need to make sure that you continue to stimulate your nipples and breasts. So what I mean by that is by pumping every 2 to 3 hours. So you need to pump on demand with your baby. If you feed your baby expressed milk, you have to pump to replace that, because your body needs to know that it still needs to make that milk for your baby. So make sure that you are still hand expressing or pumping if you end up having to take a break and or give your baby expressed milk. Okay, so let's talk about soothers or passies or binkies. I think some people call them binkies. And it's a huge debate. It's a great debate. A lot of hospitals aren't handing these out anymore because, there's nipple confusion and you're going to hear all kinds of stuff and everybody's going to have an opinion. Here's mine. I love passies and I love soothers. They are a great tool, and babies love to suck. That is what they do. They have a sucking reflex until 4 to 5 months of age, and they naturally want something to suck on. The issue becomes in the beginning when you're establishing your breastfeeding. The issue with soothers is that they are wired to bring your milk in. Okay, so remember, they are stimulating your breast tissue and your nipples to bring in that milk. And if they have a pacifier or a soother in their mouth, then a lot of times you will miss that feeding cue, and you may miss a feeding, or you may have missed an opportunity to stimulate your breasts and bring in your milk supply. And so I don't really believe that it's an issue of nipple confusion. I think it's more of an issue of missed feeding cues and missed opportunities to feed your baby, because they're sucking on that passy instead of sucking on their hands or rooting around or telling you that they're hungry. They're sucking on the passy. And so I really recommend, if you can stand it, to wait about 2 weeks before you use a passy. If you decide to use a pacifier, which is totally fine, it's your baby and you have the right to say whether or not they want to use passy or you want them to use a passy. If you decide to do that, I just want you to be really, really sure that you are paying attention to their hunger cues, okay? Make sure that they're not searching for food or they're hungry and you're missing those cues. And I didn't say this earlier, but crying is the very, very last thing your baby is going to do if he or she is hungry. That is the latest sign of hunger. And if you have a crying baby who's hungry, you're going to have to calm them down and then feed them. So try and pick up on those feeding cues early on. Bottle feeding. A lot of women are, messed up my thing. Very hesitant to give bottles to their breastfed babies. Again, I think it's because of the nipple confusion thing. However, a lot of breastfed babies are bottle fed also simultaneously, and they do fine. The big thing here is to remember that nipple bottles, it's a lot easier to bottle feed for your baby. It's an instant gratification. They get that milk this fast, okay? Whereas with your breast, they actually have to work for it. And so if you end up having to bottle feed your breastfed baby, don't worry. Just try and slow this feeding down. Use the slowest flow nipple that you can find. Slow, slow, slow. And then I actually posted this in the stories today. It's called paced bottle feeding. So if you're having to rest your nipples or whatever the case may be and you have to give your baby a bottle, I want you to pace feed. So instead of doing this and letting gravity go in, because they feed fast and they suck fast, they get the bottle really, really fast. I want you to think about how long it takes to breastfeed, which is typically, give or take, depending on the baby, 10 to 20 minutes on each, well, it just depends on each breast. But so what I want you to think about when you're offering the bottle is to slow the feeding down and use paced feeding, and try and space this bottle out over the course of a 20-minute feed instead of doing it in 5. And it makes them have to work for it, and it simulates them as if they were eating off of the breast, basically. So you sit them up and you do just enough milk in the tip of the bottle, so not like this, but horizontal. And you let them kind of control the feed. So you let them feed and then take the bottle out, give them a little break, and then go back. So that just helps slow the feed down. If you have to do that, you can also syringe feed your baby. You can just do it like this. You just kind of put it on the tip of their lips and let them lick it off. And when they're ready, they'll take the syringe into their mouth, and you can kind of let them suck and help them get it that way. And you can also cup feed if you want to do that way too, and that just kind of gives you a little bit more control over the feed and slows it down. So sleepy babies get sleepy and they want to fall asleep at the breast all the time, and sometimes you have to wake them up and remind them that, hey, you're eating, it's time to eat. What you sometimes have to do is place them skin to skin. Take all their clothes off down to the diaper, place them skin to skin. You can express milk, rub it on their lips, remind them that they're supposed to be eating. You can change their diaper. You can also get a wet wipey and rub the bottom of their feet, kind of stimulate them to wake up. So, supply and demand. Breast milk is a feedback system. And if your baby can't or won't nurse, make sure, like in the first hour, I want you so let's just say your baby had to go to the nursery for an hour. I want you to pump during that time. If you've had your baby and they had to go to the nursery for an hour, it's a good idea to go ahead and start pumping and start stimulating that breast tissue to start making the milk. That way it will help you to maintain supply. And when to seek help. And I don't know what this looks like I was thinking about this for my hospital, and I'm not sure what we're doing. Used to, you could go into the hospital, bring your baby in, and go see a lactation specialist. And I don't think that that's the case right now with COVID. So seeking help looks a little bit different, I think. But make sure that if you need help, that you reach out to somebody, whether it be your lactation consultant at your hospital. I have my Instagram page is always open to help you. It's at themamacoach.Kaci if you need me. But make sure that if you need help that you're asking for it. And I would seek help as soon as you have sore nipples or bleeding nipples. If your nipples are cracked, there is something wrong with your baby's latch and you need a little help. So definitely don't push through that and ask for help, because I want your breastfeeding journey to be enjoyable for you. And when your nipples are like that, it's hard to enjoy. So make sure you just ask, get some help. So that covers my slides. Did anybody have questions that maybe I didn't cover? When is a good moment to pump? I would not start pumping until after your breast milk is established. And by that I mean you are in a routine and you're not getting engorged anymore. Because what will happen is if you start pumping too soon, you'll tell your body to make all this milk, and you'll struggle with an oversupply, which is an equal problem as an undersupply. It causes issues just as bad. And so I would not start pumping for a stash or anything like that until 2 to 3 weeks after your baby's born, until your supply is good and regulated, okay? Does anybody else have any questions? Let me see if I missed anything up here. Thank you guys for joining. I hope that was helpful. If you do antenatal expression, will the milk you produce the first few days of baby's life no longer be colostrum? No. So you start making colostrum at 20 weeks, and then you make colostrum until about 3 to 5 days of delivery. So you'll still be making colostrum at delivery whenever your baby's born. Once your placenta is detached from your uterus, it stimulates a hormone in your body to tell your body to start actually bringing in milk. But again, that takes 3 to 5 days. And so it will still be colostrum even after your baby's born. So you'll have the colostrum during pregnancy, and then you'll still have the colostrum after your baby's born for a few days. Okay, I don't see any other questions. First pregnancy, 22 weeks now. Josie, congratulations. Congratulations, Ash. Splash 93. First time mom, Barry. Congratulations. Awesome. Andy, first time. Awesome. Y'all are about to go on a great adventure. So glad y'all joined me today. I am offering this class again. It would look a little different because I actually have slides and an ebook for this class whenever you actually register to sign up for the class. I'm offering it again on the 10th of October if you're interested in joining for the full version and to actually get the ebook after that. And that is on my Instagram page under my links in bio, and I will go ahead and link it, if I haven't already, in babies after 35's stories too. So, do you have any videos for adoptive moms nursing? I don't have any videos on that. I did write an article on relactating. So you might, if you'll add me or go to my page and message me, I can send you that link, and it kind of talks about how you can stimulate milk production if you are adopting a baby and you've had some time to know that you're adopting that baby. It's a lot of work, but it is possible, and it takes work between you and your doctor, but it is something that you could look into if it's something that interests you. That also goes for like surrogacy, intended moms that want to breastfeed. It's possible that they can stimulate those hormones to do that. It just takes work. What are the biggest differences you find with mamas older than 35 and those that are younger mamas? That's hard. I think the big thing is just where they're at in your life. I think when you're older, and I'm 35, by the way, and I was a first-time mom at 30, so I felt like I was an older mom. I know that's not that old, but anyway, I felt like I was more patient and just a little bit more patient, I think, and understanding of things. Anything else? Okay, guys, I am gonna hop off. I am gonna scroll through and just kind of randomly see where this stops and see who wants to win, or who's gonna win the Snoofy Bee changing mat and Starbucks card. So I'm just kind of scrolling, and then, okay, let's see where it lands. Sheena Simone 00, if you're still on here. Sheena. Oh, there you are. Okay. Message me. Go head over to my page, themamacoach.kaci. Message me, and we will set up a way to get you the changing mat and a Starbucks gift card. Thank you guys so much for joining me. I've enjoyed it. I hope you learned something. Message me with questions if you have them. I'm here for you guys. So thank you so much. I'll talk to you guys later. Jane, starting school in January. When do you suggest I should start pumping? When's your baby due? Or Janet? Or, yeah. It's not come. Oh, she's a month old. You're probably good to start pumping now if you want to. I would, you said you're starting school in January, so that's a little ways out. You could start pumping now. You probably don't need to overdo it. What I would do is just feed her first feed in the morning, and then pump immediately after that, just once a day, and that should get you a really good stash for by the time you go back to school. Remember, though, that when you first start pumping, you're going to do it in the morning after her first feed, and so at the first you're not going to make a whole lot, but eventually after a week or so, your body's going to know that you're wanting more milk at that specific time, and you'll make more. So hang in there the first few times you do that, because it takes a little bit of time to stimulate that milk production. But I would just do it in the first thing in the morning after you've fed her or him, and just save it. Make sure you date and time it and put it in the freezer. You're welcome. Okay, bye. Bye, guys.